Welcome to the Big Sky Care Connect Health Information Exchange Sensitive Data Training. This project is funded in whole or in part under a contract with the Montana Department of Public Health and Human Services. The statements herein do not necessarily reflect the opinion of the department. No real patient information is used in this presentation. Sensitive data includes 42 CFR facility data, coded sensitive data, and confidential data. 42 CFR data is a facility-level designation for records protected under 42 CFR Part 2. Coded sensitive data includes the listed code sets for HIV and STD data. And confidential data includes the listed code sets for substance abuse disorder, mental health, behavioral health, reproductive health, and social abuse data. 42 CFR data is attached to facility codes. Anything coming from a 42 CFR facility is considered sensitive. This protects patient records created by federally assisted programs for the treatment of SUD and other sensitive data. Under the revised rule, Part 2 has been modified to facilitate better coordination of care in response to the opioid epidemic, while maintaining its confidentiality protections against unauthorized disclosure and use. Sensitive data is hidden from users unless the user has the capability to break the glass and view the information. Based on the user's role, a clinician may be able to break the glass to view data for patients that have a blocked consent policy, or to view 42 CFR data, or to view data that is otherwise identified and blocked by system logic, such as HIV, STD, mental health, and SUD data. A clinician with sensitive data access has the ability to override policy consent in order to view sensitive data in a patient's medical record. This is data coming from a 42 CFR facility and other coded sensitive data. If the patient's medical record also contains HIV and/or STD data, a separate override will display in the form of a sensitive data button on the banner in the patient's medical record. It is important to note that whenever a user performs a policy override, this is recorded under the user's username on an audit report. A clinician without sensitive data access or a user in the clinician clerk role will not have the ability to override policy consent on a patient and therefore cannot view sensitive data. If a user in these roles tries to access the override policy consent checkbox, they will receive a stop symbol, preventing them from accessing the function, and the sensitive data button will not appear at all for these users. If a user overrides consent policy on the search and viewer screen to view protected 42 CFR data, the displayed message will show in the banner of the patient's medical record. This message is a reminder of your legal responsibilities concerning the viewing and protection of 42 CFR data. If a user overrides consent policy using the sensitive data button displayed in the patient's record to view HIV, STD information on the patient, the displayed message will show in the banner of the patient's medical record. This message is a legal reminder of your responsibilities concerning sensitive information. Now that you know what sensitive data is, let's see how this feature looks in the HIE. Log in to the HIE. Remember, you must be in the role of a clinician user with sensitive data access to view sensitive data related to a patient's medical record. Enter the search criteria for the desired patient. The patient search results display. Note the message that displays at the top of the screen. Some records have been filtered due to consent. To view the patient record without viewing the 42 CFR data, simply click the patient's name. To view 42 CFR data for this patient, Return to the Search and Viewer screen by selecting the Back to Patient Search button. The search criteria is still listed. Scroll to the Override Consent Policies section and select the Override checkbox. 3 required fields display. The Authorized by Patient checkbox is selected by default. If someone else is authorizing this override, unselect the checkbox and enter the name of the authorizing person. The authorization type defaults to emergency. Enter a reason in the reason field, and then select Enter. You are returned to the search results. Select the patient's name. The patient record is opened, and the clinical summary is displayed. The patient's record contains 42 CFR data, and the legal text is displayed in the banner. Notice the alcohol abuse listed in the diagnostics section. Under Procedures, you can view the drug screen procedure and see the alcohol abuse diagnosis under the outpatient encounter in the encounter screen. Return to the clinical summary. Notice the sensitive data button on the banner in this patient's record. To view HIV, STD data for this patient, select the button. You can choose to view both HIV and STD data or one or the other. The Authorized by Patient checkbox is selected by default. You can uncheck the box to enter the party that authorizes this override. You are required to enter a reason. The authorization type defaults to emergency. Then select Accept. Again, this override will appear on an audit report with your username. Notice there is a banner that displays for sensitive coded data. This record contains sensitive information protected under Montana law. This information may not be shared or further disclosed, except as specifically authorized by applicable law. Also, see the new diagnoses listed. And under the Procedures screen, new procedures are listed for this sensitive data. When you are done viewing the patient's record, log out of the HIE. And it is as easy as that. If you need further assistance or would like to learn more about Big Sky Care Connect and the HIE, please reach out to us and we will be happy to assist you. Thank you for watching.